Your spine supports the entire structure of your body. It allows you to stand upright and protects your nervous system that relays information from your brain to the rest of your body. When you're in a neutral position, such as standing up straight with your arms at your sides, your spine is at its strongest. But as soon as you start to bend or twist, you place stress on the discs and vertebrae in different directions. This results in your back being less able to resist or apply a force. Let's take a better look at the parts of the spine. Your spine consists of 24 vertebrae divided into 3 major segments: the cervical, thoracic, and lumbar regions. Because of these 3 regions and their natural S shape, your back is strong and able to evenly distribute weight. In fact, the curve of your spine makes it up to 10 times stronger than it would be if it were completely straight. Remember, it's always better to have a spring than a rod for vertical compression. And as such, this natural S-shaped position is the strongest your spine can be. The cervical spine, commonly referred to as the neck, consists of 7 vertebrae that are small and mobile, and good at twisting. It also keeps your head from flopping about. Your thoracic spine, or mid and upper back, consists of 12 vertebrae that are larger than the neck's, but are still quite mobile. This section of your spine allows for motion and support of your trunk and attaches to the muscles of your back. It also provides protection for your heart, lungs, and other vital organs. The lumbar spine, or lower back, consists of 5 vertebrae that are the largest bones in your back. They're fairly immobile, but they're great at bearing loads. The sacral region over here connects to your hips and your coccyx below that. This section helps you sit comfortably and has muscles and tendons attached to it, including the pelvic floor muscles that help you go to the toilet and your gluteus maximus, or bum muscle, that helps you walk. Between each of your vertebrae is a disc that consists of a fluid-filled sac or nucleus at the center. The nucleus is surrounded by tough, cartilaginous fibers called annulus arranged in a radial onion ring pattern. The discs allow for 6 planes of movement, keep your vertebrae from rubbing together, and absorb shock. The primary job of the nucleus is to act like a shock absorber, lessening the impact of normal movement forces as we go about our normal activities. Where a force is applied to the spine, and by extension the disc, dictates how the nucleus will change shape. Pressure on the front of the disc, like when bending forward, causes the nucleus to move towards the back. The nucleus of the disc is hydrophilic, meaning it attracts water. But as you go about your normal workday, some of the water is lost, resulting in a decrease in the height of the disc. After your 20th birthday, the disc's ability to restore water starts to decline and the blood supply to the disc disappears. There are 2 sets of facet joints on each of your vertebrae, and they prevent your spine from slipping or twisting excessively. Repeatedly bending forward or rotating your trunk, especially when carrying a load, results in significant forces in the facet joints and surrounding ligaments and can contribute to injury and pain. Narrowing of a disc can result in the tips of the facet joints resting on the vertebrae below. As a result, a compressive force is directed through the bone instead of the disc, causing considerable pain. Your muscles allow you to move around, and contrary to popular belief, it's not always size that makes them more powerful. How well your muscles work and how much force they can exert depends not only on the size, but also on the geometry of the joint, the angle at which force is applied, and the length of the muscle. This graph shows the relationship between the length and tension of a muscle. In other words, the amount of force it can exert based on its length. As a muscle increases in length from a shortened position, it's able to generate more force until the optimal length is achieved. After this point, the maximal amount of force that can be generated starts to decline. Other factors can also affect the amount of force that your muscles can exert, including age, gender, physical condition, and motivation for a task. Remember, warm muscles perform better than cold ones. They allow for an improved range of motion of the joints and make the connective tissues more supple, reducing the chance of injury. Your muscles also contract more smoothly, while your nerves are more reactive, resulting in improved muscle efficiency. Ligaments join your bones to other bones and are responsible for the stability of the joints. They can resist high forces and are extremely important for limiting the range that a joint will move, while also resisting any sudden forceful movements that could lead to injury. However, sudden movements and repetitive and static awkward postures can stress the ligaments and contribute to developing an injury. Your tendons join your muscles to your bones and allow the muscles to move the rest of your body. When you perform repetitive tasks, the blood flow increases to the muscles doing the work. At the same time, the blood flow to your tendons and ligaments decreases, contributing to the amount of cell death in the tissues. This effect is also noticeable when undertaking tasks that require static postures.